I am Dr. Shahid Abbas, consultant allergy and immunology. I like to talk about a very important subject. It is a scientific and immunological basis of immunoboosters when given along with the allergy vaccine. There is an enhancement of the immune response. And what are those immunoboosters? They are the PRP, zinc, vitamin C, probiotics, and magnesium. It is well established that when allergy vaccine is given to the patient suffering from the allergies, but it is important to note that the allergy vaccine has to be customized and specific for that same patient. When the allergy vaccine is given to the patient should be responding in 2 to 3 months. And the response is due to the production of neutralizing anti-IgE antibodies. As you know it well that allergy, the main cause of allergy and other immune diseases are the damaging antibodies. In allergy, it is IgE. Not only the IgE is produced due to the allergic reaction or allergic disease or immune disease or autoimmune disease, and along with the antibodies, there are produced cytokines. Now the cytokines, two types of the cytokines are produced. When the person is in good health, anti-inflammatory cytokines are produced in excess, and pro-inflammatory or damaging cytokines are very less in volume and very less produced by the body because the immune system suppresses those damaging cytokines. But when there is an allergy or immune disease or autoimmune disease, the cytokines, which are the good cytokines like anti-inflammatory cytokines, are suppressed, while the damaging cytokines or pro-inflammatory cytokines are increased. This happens in all the immune diseases along with the allergies. But when the immunotherapy is given, the reversal takes place. Against the damaging antibodies, starts producing the neutralizing antibodies, anti-IgE antibodies. Body also starts producing excess of the anti-inflammatory cytokines. And due to the allergy vaccine, the pro-inflammatory or damaging cytokines are suppressed and they are decreased. Now, when the immunoboosters, this process is going on with the allergy vaccine. That is production of the neutralizing antibodies, anti-IgE antibodies, increased production of the uh, anti-inflammatory cytokines, and the suppression of the pro-inflammatory cytokines. But when we give the PRP and other the immunoboosters, this process of production of the anti-inflammatory cytokines and neutralizing antibodies and suppressing of the pro-inflammatory cytokines, this is immune response is enhanced. So when increased number of the neutralizing antibodies are produced, increased amount of the along due to the immunoboosters and sublingual vaccine, there is an earlier response due to the increased amount of the neutralizing antibodies and increased amount of the anti-inflammatory cytokines and suppression of the pro-inflammatory cytokines. So I have a scientific evidence and I have quoted a lot of uh, papers, review papers and the references about the effect of the immunoboosters like PRP in, in enhancing the immune response and helping the sublingual immunotherapy to have a better response and the patient gets improved much earlier as compared to when he's taking only the sublingual vaccine.
I just like to show you our long journey of about 35 years when I was the chief of Allergy and Immunology, National Institute of Health. After coming from England, we were using the injectable vaccine with a lot of reactions and lesser response, and the people used to get rid of this vaccine, and they try to avoid the vaccine, used to have a few injections, and then they refused to have these injections. Only 20% used to carry out. That's why people were having a lot of problems. And at that time, I had decided to develop the sublingual vaccine, and it was not known anywhere in the world at that time. And then from 1990 till 2002 to 2003, we developed the sublingual allergy drops, and we were the first in the world to develop the sublingual drops. When I conveyed it in the on my allergy congress, which was Australasian uh, Asthma, Allergy and Immunology Congress. There, I disclosed that I have developed this vaccine, and nobody could believe at that time that sublingual vaccine can be effective. But the effectiveness was proven in 2011 with the next slide that I'll be showing you how it becomes effective when the allergy vaccine is given. So it was a long journey of 35 years of developing from the injectable vaccine to the sublingual vaccine. So I'm also the member of the different committees of the American Academy of Allergy, Asthma and Immunology, European Academy of Allergy, Asthma and Immunology, and the World Allergy Organization. And I'm involved in developing, along with my colleagues, in developing the teaching material and the training material for the doctors who want to become the allergy specialists. I just want to show you this journey, over 35 years of journey for developing of the from the injectable vaccine to the sublingual vaccine. And I have presented my scientific paper in my World Allergy Congress is also informing that we are the first in developing the multi-allergen sublingual vaccines. Now, the sublingual vaccines which are produced in the world are single allergen vaccines. So if you are allergic to 4 different things, then you have to take 4 different vaccines at the same time. Whereas we customize and develop for the vaccine for each patient, putting more than 4 vaccines, 4 allergens in the same vaccine. So you don't have to buy expensive 4 vaccines with the same cost of the 4 vaccine, single vaccine. We give the 4 vaccines in one bottle, so that becomes more effective and more economical for you. So I have a lot of queries from my patients and from the doctors asking me injectable vaccine is more effective and the sublingual vaccine is not effective. It has been proven, and one their paper was published in 2011, proving the mechanism of effectiveness of the sublingual vaccines. What happens that when you can see when the allergy vaccine is sprayed on the tongue or put a tablet on the tongue through the mucosa, the allergy vaccine goes down through the mucosa and taken up by the dendritic cells or antigen presenting cells, and those cells, then those dendritic cells or antigen presenting cells, they go to the lymph nodes where the T regulatory cells, with the help of T regulatory cells, they start producing the anti-inflammatory cytokines, pro-inflammatory cytokines, production of the IgA antibodies, and also the neutralizing anti-IgE antibodies, which is IgG4 antibodies. So the anti-inflammatory cytokines which are produced are the IL-10, IL-18, SLAM, TG-beta, while pro-inflammatory cytokines which are produced are the IL-4, and these pro-inflammatory cytokines are suppressed with the allergy vaccine, which I had informed earlier too. In this slide, this is the infographics. Uh, I have shown that when a person takes allergy vaccine, it is sprayed on the tongue. It is some error in making the infographics. In fact, it should be sprayed under the tongue. So you can see neutralizing anti-IgE antibodies are produced. Then there's a increased production of the anti-inflammatory cytokines at the top, bluish one, and in, those are anti-inflammatory cytokines help in the relieving of allergies, getting rid of allergies, and the suppression of this allergy vaccine causes suppression of the pro-inflammatory cytokines in the red one. They are produced in excessive amounts during the allergic disease, but when the anti-allergics or not the anti-allergic, when the vaccine is taken, this damaging pro-inflammatory cytokines are suppressed. What the good uh, anti-inflammatory cytokines, which are needed for the good health and improvement in the allergies that is produced in the excessive amounts. Allergy vaccine is not like antibiotic that you take one tablet of the augmentin or the capsule of the any antibiotic morning, evening, and you get rid of infection. And the same as the antibiotic is given to everybody, the same dose. The allergy vaccine has to be customized specifically for each patient according to the results of the allergy tests. If they are not customized, the allergy vaccine is not effective. There's nothing like general allergy vaccine. It has to be prepared for each patient, and then only it is effective. So, as I said, when the sublingual immunotherapy or allergy vaccine is given along with the PRP, vitamin C, zinc, magnesium, and probiotics, they induce together enhanced immune response and they induce the tolerance. So, tolerance is created by increased production of the neutralizing antibodies, anti-IgE antibodies, boosting the anti-inflammatory cytokines, increased production, and suppression of the pro-inflammatory cytokines, which are the dangerous cytokines, and they are damaging cytokines. They are suppressed with the immune response given by the together with the sublingual immunotherapy and the immunoboosters. Vitamin C is the first in the group. It's a powerful antioxidant, enhances the neutrophil and lymphocyte functions, decreases the production of the pro-inflammatory cytokines like IL-6 and TNF-alpha, and strengthens the immune system. So you can see zinc is also very important. It is an essential cofactor for immune enzymes. It helps the immune response generated by the vaccine, allergy vaccine, by producing increased production of the antibodies, neutralizing antibodies, increased production of the anti-inflammatory cytokines, and suppression of the pro-inflammatory cytokines. So same effects. So zinc, along with the sublingual vaccine, promotes immune tolerance and reduces mucosal inflammation. It's very important, and I give it to every patient. Third is the magnesium. The list of immunoboosters is very important for allergy and for our other diseases too. It is very important for the heart patients also. So it is in fact a cofactor for more than 300 enzymes. It has this when given with the allergy vaccine, it enhances the immune response in the same way helps in the production of the neutralizing antibodies, suppression of the and pro-inflammatory cytokines like IL-6 and TNF-alpha, increased production of the neutralizing antibodies, and increased production of the anti-inflammatory cytokines. So important to note magnesium relevance with the sublingual immunotherapy is that it prevents the allergic exacerbations and supports the adaptive immune response. It's really very important, and I recommend this to all my patients. In fact, I give the zinc, magnesium, and vitamin C, which are important immune boosters, in the tablet form. And this is a unique tablet and a unique immunobooster which I have prepared and formulated and prepared for my patients from one pharmaceutical company, and I give it to all my patients who are taking the allergy vaccine. And the name is Immunoboost tablets. I will recommend this to all the patients who are taking the allergy vaccines. So the fourth in the group is the probiotics. It is really very important, and has a lot of significance in not only allergies but in also other diseases also. So it must be taken regularly along with the allergy vaccine because it enhances the same, scientifically proven, it enhances the same immune response which is initiated with the allergy vaccine. That is increased production of the neutralizing antibodies, increased production of the anti-inflammatory cytokines, and suppression of the pro-inflammatory cytokines. In this slide, I have shown you the same immune response which is produced by the other immunoboosters. Probiotics also contributes to the same immune response. So probiotics relevance with the sublingual immunotherapy. It improves the mucosal immune tolerance, reduces allergic inflammation, synergize with SLIT to reprogram immune systems, and the examples which are lactobacillus and bifidobacterium species. They are very important in creating the allergy immune response against the allergies. PRP or platelet-rich plasma I have recently started for my patients after reading a lot of research papers, and they are this is really helpful in helping the immune response created by the allergy vaccines, and it's found to be immensely important and beneficial with the allergy vaccine. So I have recommended to all the patients to have this every 2 months. So what it does, it helps in the release of the growth factors. It induces the T-regulatory cells, which I have mentioned before also, the T-regulatory cells, and increase production of the anti-inflammatory cytokines like IL-10 and TGF-beta. Suppresses the pro-inflammatory cytokines, which are dangerous cytokines like IL-1 beta, TNF alpha, and IL-6. So this is really very important, and I recommend to all the patients all over the world to have it because it has a scientific significance. I'll show you the research done on it. So I want to show you actually what happens, how PRP immunologically enhances the effect of the SLIT. If a person is taking SLIT, PRP is administered, immediately there is a release of the growth factors like TGF beta, PDDF, and VEGF. Then there's an induction of the T-regulatory cells I have mentioned. This is infographics which are graphically I want to explain to how it happens. The T-regulatory cells are prepared. They are activated. There's induction of it, and those cells they start producing increased amount of the anti-inflammatory cytokines like IL-10 and TGF-beta. When it is in fact the same immune response which is initiated by the allergy vaccine, but the PRP and others they enhance the same response, and the same uh, anti-inflammatory cytokines are increased production. So suppression of the T helper 2 cells which produce the damaging or pro-inflammatory cytokines like IL-4, IL-5, and IL-30. They are, when you have an allergic reaction or allergic response, IL-4, IL-5, and IL-13 are increased there. But when you take the vaccine along with PRP, the same damaging the cytokines are suppressed. So there is a reduction in the mast cell IgG4 antibody production. Then enhancing of the tolerance. So it's really very helpful when taken along with the sublingual immunotherapy or any allergy vaccine. I highly recommend to all the patients having the allergy vaccines. Here I have quoted some of the references supporting that the immunoboosters like PRP, zinc, magnesium, probiotics, vitamin C, all are effective in enhancing the immune response. So these are the paper's scientific references supporting PRP when given with the SLIT. There is the immunomodulations. Next, I'll show you more. This is the scientific evidence of the regulatory T cells and allergy suppression. Role of the T regulatory cells in allergy control. These are all the important papers suggesting the role of the PRP and other immunomodulators and immunoboosters to help the sublingual immunotherapy or allergy vaccine for a better immune response. So these are the papers suggesting the production of the increased amount of the anti-inflammatory cytokines like IL-10 and TGF-beta and suppression of the and pro-inflammatory cytokines like IL-4, IL-5, and IL-13 with the PRP and the immunoboosters along with the SLIT. So these are papers indicating the scientific evidence of production of the neutralizing or blocking antibodies with the SLIT, sublingual immunotherapy or allergy vaccines, and the immunoboosters. This is a very important paper, effect of the PRP and the effect of as an immunomodulator for production of the cytokines, increased production of the anti-inflammatory cytokines, and suppression of the pro-inflammatory cytokines. So let's summarize it. With the allergy vaccine, SLIT, PRP, and the immunoboosters, there is increased production of the anti-inflammatory cytokines like TGF-beta, IL-10. The suppression of pro-inflammatory cytokines like IL-4, IL-5, and IL-30, and increased production of the IgG antibodies or neutralizing IgG4 antibodies or the neutralizing antibodies which are produced against the IgE antibodies. These are in fact the anti-IgE antibodies. When these anti-IgE antibodies are produced, they combine with the IgE antibodies, antigen antibody reaction takes place, and then they are damaging IgE antibodies are neutralized or become ineffective, and they don't do any damage. Now let's summarize all in this infographic. On the left side are the ingredients that all the 5 immunoboosters: PRP, magnesium, vitamin C, zinc, and probiotics. In the second row, you can see that all 5, along with SLIT, they boost the production or increase or enhance the production of the anti-IgE neutralizing antibodies. In the third row, you can see all 5, along with the SLIT, cause increased production of the anti-inflammatory cytokines. And in the final row, you can see all five would have a increased suppression of the pro-inflammatory cytokines, which are important in causing allergies. So overall effect of the anti-inflammatory cytokines, neutralizing antibodies, and suppression of the pro-inflammatory cytokines, there is a immune response, and the person gets allergies of the person, whether it is allergic rhinitis, hay fever, eczema, asthma, IBS, or brain allergies. All are improved with the allergy vaccine and the immunoboosters. The same thing, finally, conclusion. Immunoboosters, PRP, zinc, vitamin C, probiotics, magnesium, when given with the SLIT, enhance the immune response. And what is the immune response? Boost in the production, increase in the production of neutralizing antibodies, then leading to the increased production of the cytokines, the anti-inflammatory cytokines, suppression of the pro-inflammatory cytokines. So all together they promote tolerance. You get better in much shorter time. You are not protected against allergies. You are protected against the other infections, and your even autoimmune diseases are improved. Thank you very much, and God bless you.